Okay, Assalamu alaikum everyone, and welcome to the second session in CHSR's Workshop Series 2.0. I hope you're all doing well. I'm Mariam from second year MBBS here at FMH, and I'll be moderating today's session, which will be focusing on writing a letter to the editor, or in short, LTEs. So in our last session on Friday, on where we discussed the basic principles of research, we left out LTEs on purpose because this workshop is all about LTEs, and our speaker today has a lot of experience writing LTEs. So without further ado, I'd like to introduce and welcome our speaker, Dr. Mariam Tariq Awana, who has been kind enough to join us online from the US, where she's currently working as a first-year resident. She is an FMH alumna as well, graduating in the class of 2018 and completing her house job at FMH from 2019 to 2020. During her time here as a student too, she was a very active member. She was president of the Debating Society in 2018, a part of the sports club and the Dramatic Society management, and also president and one of the founding members of Humans of FMH Society. So you might all agree she is nothing short of an all-rounder. Her expertise in research and willingness to help out current FMH students has made her an integral part of CHSR, and we're grateful to her for always making time for us. So with that, I'd like to give the virtual stage over to you, Dr. Mariam.
I didn't know that my introduction was that long. Assalamu alaikum, everyone. Welcome. I'm glad that you guys are here for learning some of the stuff that I've learned over the years. It's not something that's going to be A plus B is equals to C. It's going to be something that you are going to actively learn. So my thought process while making this presentation, I didn't have to go through a lot of stuff. I was thinking about what could be our agenda, what we could do. Can everyone see my screen, right?
Yes, it's visible.
Okay. So we'll be discussing some of the stuff, what are components of letter to editor, how to brainstorm the topic, when to write, any example or any criteria of the journals, like some of the questions that you guys send me that also included, you just talk about what are the criteria of different journals, how do we modify it, and how do we write it down. Okay, so I did put one of the link that I used for this whole presentation. That's one of the articles in NIH, that is National Institute of Health. So without further ado, let's introduce actually what's going on, what would be our components today. So what is the letter to the editor? It's basically a very short form of communication. Like it is like the way we used to write letters before. It's in a way that you're writing a scientific letter in which you're telling the journal about anything that you found interesting about the topic, and if you want to comment about any case report or any article that's been published before. So letter to the editor is generally a short form of communication, can be written on every topic which attracts attention of the readers. So this whole line is a little bit very broad, like what could attract the attention of readers. So one of the questions that you guys sent me was like, what kind of letters should be? So for most of the journal, letters are important. They're published under surveillance to the editor. The most frequent reason for writing a letter to editor is comment on a published article. However, the interpretation should be objective, constructive comments, and the authors of the articles are invited to respond to these letters. And though the most frequent reason for writing a letter to editor is to make a comment on a previously published articles, also research reports, case series, or an adverse reaction to a drug can be reported as letter. So it's a very broad thing. What kind of things you can add into a letter? Either you would be commenting on a review article or case series or anything that you find needs to be addressed. There are types of letters that you write it down. Some are common and then some are uncommon types. The common types include comments in the form of response to previously published article, positive or negative comments, a brief feedback on clinical data or research data, feedback on a case report, Or uncommon types are comments on common medical issues or journal policies, comments on journals quality or format, statement on patients, access to study material or collaborative study. Having said that, this time I have written both type of these letters. Some of them I have written myself on medical issues, not on journal policies, but some of the medical issues that we are finding. And the interesting part of writing to a letter to editor is that you're not just writing down, hey, I found this letter, I found this article, it was very interesting. No, the wordings are not like that. You will be introducing that concept, why you think this thing is important, where is the literature been so far, and what are your comments. So these are few components of letter to editor, and you have to write it in a flow, in a concise manner, in a communicative manner, so it should be more attractive towards your audience. So a small guideline for writing a comment letter on a published article. So these things are very much important because you can't be rude, or I would say you don't have to show attitude while, like, if even you differ from one of the articles and author, you have to present it in a scientific way. Why do you think this thing should not be like this? Must be courteous, maybe specific rather than journal comments. This is one of the things that you learn while you rewrite and write and rewrite, because writing a scientific statement is not itself very, I would say, it's not like you're writing a novel. You're writing a scientific comment, and that should have a base towards it. It's not something, oh, I like flowers. So it can't be like, oh, yeah, so this article explained liking flowers. No, you would say this article explained, enhanced. So adjective tone, an objective way of defining things. Make specific rather than journal comments. Instead of biased opinion, your comments should be based on scientific evidence. Do not repeat topics which were studied in the original article. Approach the subject matter from a different perspective. Present additional data and use a brief and concise wording. Now we'll take a pause over here. Why I want to take a pause here, because I know some of the people were joining this thing, and some of you might be like, oh, she's so fast, I don't know what exactly letter to editor is, and she's talking about the guidelines, and the presenter is talking about some of the stuff. So if anybody could ask me a question in the chat box, what exactly are your thoughts what a letter to editor is? If anybody has ever read a letter to editor, that will be great to know. I'll be reading your comments. You can send your messages in. Do you know what exactly a letter to editor is? Interesting. So my question to you guys was why this I asked you this question, because when I was a student and I was about to write a letter to editor, I didn't know what the basics of letter to editor is. Yes, it can be a critique or comment on an article, for sure. That's what the definition is. And there's also some of the stuff that we need to talk about today in letter to the editor is that we should be mindful what we are writing is has a scientific base. It's not something we can just write it down to letter to editor. Like we see Dawn is one of the most famous, I think, newspaper in Pakistan as it comes to news. So their letter to editors are entirely different than letter to editors in medical journals. Just clear that thing for first. Secondly, when you're commenting on any article or on any case report, you should know what component you really differ to or what component you really want to appreciate. It can be appreciative letter, it can be letter of critique, it can be letter of comparison. In comparison, you can write down, oh, these studies have been done on the same subject for these years, but no evidence data has shown this thing to be. So this is why this is important, why I'm bringing this question into the subject matter. And why letter to editors are important for journals is too, because it creates a creative platform for every scientific based studies that are going on, or even the scientists around the globe. Like it give you a creative platform to talk about something which has not been addressed before. I remember I wrote a letter to editor about divorce rates in surgeons. And I said, it was written as a collaborative effort while I was a medical student. So in that letter, we literally discussed what has these studies shown so far, why the divorce rate is higher in the surgeon population, what studies have shown to be the cause, and what has been the effect of it, and where we can improve. That's all you have to write in letter to editor. So what your topic is, why do you think it is important, why the answer, the third question is that what other datas are there, and fourth, what do you think about it. So thinking about it is also a very subjective matter, because you can't be just like, oh, I think this things to need to be like this. For thinking like that to be solidified, you should have a base towards it. You can't just comment on stuff which you do not which you believe maybe, but you do not have a scientific base towards it. So this slide really concisely says what letters written to. So they are written to the editor or the author should be objective, constructive interpretations, or discussions on medical, scientific, or journal areas of interest. They should have an objective and give a message with a brief and clear language. Materials which were published or reported elsewhere should not be used, otherwise the letter will not be accepted. That's very important thing to know, that why like we talk about plagiarism, using constructive way of writing. Scientific writing is its whole a big subject. As you grow up, like you're in first year or second year and third year MBBS, and you start writing, even writing a single sentence takes sometimes very much time. It's not like easy enough that you are like, oh, I know this is the thing I want to write, but you have to be mindful that these things have not been used ever again. Because if you plagiarize or use the language that's been used else before, then that thing is already excluded. You would never be accepted in a journal if you have any plagiarism associated with the manuscript you write. Okie dokie. Having said that, this table was very much important, I think, in that article, which I'm deciphering right now, to be honest. I'm being a detective here and deciphering the components of the article that I shared. Like, what are the problematic issues into letter to editor? Because these things will be really much helpful for you while you're writing. You'll be like, oh, am I writing something that is biased? There are so many figures, there are so many references. Is it aggressive or like a very bad tone that I'm using? Is there irrelevant comment? Is it reiteration of the points? Is it journal comments? Is it ambiguous? Is it unnecessary or long letter? Or there's no lack of any new or helpful information? Comments or personality or incompetency of the author? So, having said that, I know that there will be some questions in your mind, like, what are we writing in a letter if we can't be biased a little bit? We can't comment on the way author is writing or like that. So, in letter to editor, you're not targeting the author; you're targeting the literature that's been written. So, for example, if I write down, like road traffic accidents are the leading cause of death, right? Among the globe, and what has been done so far, or what new innovations we could bring in to prevent those things. So that could be one of the idea that I have in my mind. Then I look into the literature, how many studies have been done, what preventive methods they have explained about it, what kind of things are common in all the studies that has been common factors. So you'll use those common factors. You'll say The studies that have been done before indicated that these things are the factors that are leading to road traffic accidents, and how the laws have been made. You can write down, okay, these laws have been made. And then last point of your conversation to the editor is, it's just a conversation you're making towards the whole scientific platform, is that I think this area needs to be more highlighted. Maybe there's a lot of room for improvement, or room for more literature to be searched. Even if you want to write about any mortality, or like pediatric mortality, like child mortality rate in least developed countries, I'm just giving you some ideas. So, like, how you should approach that question that you have in your mind, to write it down in a communicative way. Because you can't be biased, you can't be like, oh, I think this is what they are saying. No, you have to compare the whole data. You have to, like, even writing for a letter to editor, if you're thinking that, oh, this just required 4 to 5 references, I'm going to just read 5 to 6 articles and done. Nope, it doesn't happen like that. I remember that we have to, like, at least read, I would say ideally you could read 20 articles on the same thing, and compare and contrast it, and then choose your top 5 which you want to put as a reference, who are more authentic things, and then deciphering the language in the letter. That is also very much important, because if you're not able to convey the message clearly and in a concise manner, that loses its effect. And if it loses its effect, then it's not needed there. Some of the important consideration while writing a letter to editor, I think we have talked a lot about it, but I'm just going to reiterate it here. Deliver an understandable message, should comply with journal's format. That was one of the question. I think somebody said that, what are the journal's format? I have an example at the end of the this presentation, like how we can see what are the criteria of a journal, and how we can write a letter to editor like in that format. Should contain adequate important information about the article, because if you are talking about an article, generally it should be written to deliver objective and constructive comments on published articles. They should be brief and conclusive. Conclusive is a very broad word that's been used here. Your last 2 lines should be like deliverable. There should be so much attractive. Like if I'm reading from the top to bottom, I should be so much attentive towards what's written in that letter to editor. So I should not have another question on why she wrote it, why he wrote it, what was the reason behind it. So this is one of the criterias that I was searching, and I'm going to end my thing now after that, and I'll be asking you questions. You can open your mic and ask me any questions you have about letter to editor, because I know this is a lot of information that I've given you, but I want you to just breathe a little bit and ask me questions, whichever, any question. It could be easy question, hard question, anything you think in your mind. Just don't be afraid of that. So this is from JAMA, that is Journal of American Medical Association, which I very like, because the articles written in that journal are very like communicative. You enjoy reading them. They're not like redundant, and you do not have to decipher a lot of words. So here they say it should be concise. We talked about it. Focus reports of original research can include any of the study types listed under original investigation. How many words? There's always a word limit to letter to editor or any article you write. 600 words, no more than 7 authors. That's one of the conditions. Less than 6 references. So letter to editors usually have 6 to 9. 9 is the maximum that I've seen in any letter to editor criteria. No abstract or key points. Letter to editor never has abstract or key points. That's for sure. For JAMA, sometimes they require key points or keywords. Like if you're using a very big terminology, like if I say MELAS, that is a disease, so I would be saying what that disease says about. If I'm saying type 1 diabetes or DKA, that is diabetic ketoacidosis, so I would be explaining that word. Sometimes they want to write down about the keywords. What is the data sharing statement? What is this is a equator reporting guidelines that says the literature should be authentic and all those stuff. So every journal that you look into, there will be a word limit, there will be author considerations, there will be a limit to references, there will be limit to what you're writing. So this is how the letter to editor really signifies what it is. So let's open the forum and ask the questions. Okay. You can raise your hands and the moderator can ask them what question they have. Okay. Okay, so the question is, can you tell how do we even select a journal to begin with? Really? So that's a very good question, I would say. How to select a journal is a very broad term. Journal selection depends upon your interest. So there are hundred and thousands of journal around the globe. You can either target a Pakistani journal, you can target international journal, and then you have to see the criteria of the journal. Like even if it is for basic sciences, like it's talking about anatomy, but biochemistry or physiology, then you would not be writing about OBGYN there, right? You would not be talking about pediatric things there in that journal, right? So it depends upon your interest. Like if I want to go in psychiatry and I want to write down every research article and every research literature in for psychiatry, so I'll be targeting the psychiatry journals. To begin with, that's a very good question. There is a very big monopoly around that is called impact factor, how the journal is famous, how many people read the journal. So impact factor of a journal means that how many people that journal is reachable, and how many in a very simpler way, it's a long terminology, how many scientific people address to those articles and really rely on those literatures that's been written into the journal. That makes it more authenticate. So it's not that you will be writing in a letter to editor in a smaller journal, it would not have an impact. It would still have impact, but if you can reach the sky, that's the limit. But if you want to begin with, there are journals in Pakistan, Biomedica, I remember there are other UHS journals that you can reach out and read about. And always, whenever you're writing even a case report, letter to editor, or any literature thing, always read the journal. Like you have to read the articles in the journal, the way they are written, because there is a way and specification or specific tone that you will grasp from those things that are already written, and that will make your life easier. So if I have to target JAMA or if I have to target Biomedica for sure, I'll be having a copy of that journal and I would be reading, oh, how people write the letter to editor. And that was my beginning point, to be honest. I did not have a scientific background. I did not know what scientific literature looks like that. I just knew what is English and what grammar is and how can we write it down in a very specific scientific way. And then if you write it down, something related to all those components that are being specified in that journal, like you have to be 600 words, you meet that criteria, you have less than 6 references, you have a very innovative idea that you are talking about, then get a mentor also, let it checked. Do not go blindly into that. Like your first year, yes, you can write, but you still need people on your above you that can even look into that. Our community medicine department used to be very good. I don't know who the people are right now, but they're very helpful. The professors there are also helpful. They write down scientific things. Pathology department is very much good. I and they write down scientific letters too. I know in anatomy department there were some people who used to write, so reach out to them like, hey, I think this is a good idea. They would also discuss and brainstorm with you. So have a mentor who can talk, you can talk through them, and then they can show you what needs to be important, what needs not to be included, how can you improve it. So that's the very best way to go about it. Okay. What is that? A source was mentioned from where we could read letters to editor. Can you please ask the name of that journal source? I don't know what exactly that question is. It can be comment or critique. Can someone tell me? Oh, there's a very good question that says, is letter to editor worth it? Why not? Whenever somebody looks at your CV, they would not be like, until unless you're becoming a professor or you're becoming an assistant professor, and that's very down the lane, right? You are just beginners. You do not need to be the best, I would say, uh, researchers around. If you write a letter to editor and that thing get published, that's a published thing. Anything that's published is worth mentioning in your CV. And why not? I think I have 2 or 3 letter to editors and they're still in my CV. And if I go to for an interview, or even for my interview last year, I mentioned those things in my CV and they were like acknowledged. So yeah, they're worth it. The source that you guys are asking, I think I told about the NIH and I shared the link towards it. That's in my this slide to do letter to editors, add substantial volume to your CV. I think that's I have answered that question. How is writing a letter significant for students? P.S. What should be our objective while starting on this? Why is not it significant for students? I don't know why somebody instilled in your mind that it's not significant. It is significant, to be honest, because that's something you're writing. Even if you're commenting about a literature that's been written, you're learning something. And letter to editor is significant because you're getting a page signifying whatever you think, whatever your thoughts are about something in a journal. That itself is a big thing and big achievement. If you start from letter to editor, then jump on to case reports, then review articles and other stuff. That's the way. I think baby steps always help you. What should be our objective while starting on this? So objective could be anything. If you have an idea like, hey, why this research is going on this subject, why this drug is important in this thing. First year might not have that solid background towards it because you need to have a medical knowledge to even think about these things. But you can always talk about anatomy subject. You can talk about physiology. You can talk about, if you're third year, you can talk about immune modulators usage and different diseases. So it's a very broad term. What should be your objective? Your objective should be clear. Like, why do you want to write about this subject? Has anybody ever touched about this subject before in their letter to editors? And if they have, what new aspect you are going to talk in that letter to editor? That's always important. Research is a good component because it gives you a way and a platform for innovation to think out of the box rather than talking about redundant things. Hi, if paid journals publish LTs for free if the letter is on an article published in their journal. Paid journals publish letter to editor for free if the letter is on journals published in their. Okay, the payment thing and everything goes very broadly. As a student, I would always say target on those on those journals which are free, where you don't have to pay a lot. Because paying, I don't think so, is always worth it until unless that impact factor that I think IF means impact factor. Impact factor is good. So then you can pay to them. And if you're commenting on their articles, yes, sometimes they are free. Mm, Okay, I think Eeman commented on there. Peer reviewed as well. Not all peer reviewed publications are worth it. Yes, peer reviewed articles are always worth it. Um, JAMA, yeah, the JAMA is the American Association, Medical Association one. The article should be recent, right? There is a time frame for LTs. That's a very interesting question. Like it does not decipher this component does not like limit your ideas. Like the article should be recent, right? There's a timeline for that. We always talk about whenever we're writing literature or having a literature search, not more than 10 years. Like it is 2023, so you can read the articles till 2013 because that's the new latest thing. But if there's something rare modality, there's some diseases that are very rare and there's not been a lot of research on that topic, then you could broaden your time frame too. So do not limit yourself towards it. Okay, what is the question? A bit off the topic. Okay. I think Nurul and this question you can direct ask me about my journey so far, and I would love to answer that. Or you guys can have another session on that topic. At least I would love to answer that. Is it ethical to write LTs for a closed access articles which we haven't paid for, but we found it through? Okay. That's a tricky question. Usually not. Um, you should be always disclosing how you got the resources. But have people not written on it? Yes. And I would say always use open access articles for your stuff that you're writing. And if there is closed access, always ask your library in your medical school. They usually get the access for you. So it's doable to find closed access articles too. Yep, that's the short answer to that question, I would say. Any other questions that I have? Anyone who wants to talk? All these questions. Eeman and Maria, have we answered every question?
Okay, so let's wrap up the session then. I hope it was beneficial for everyone because, as you've heard, LTs are easy to write and they're a great way to start out your career in research. And thank you, Dr. Mariam, for joining us, for taking out the time.
Just a second. There's a question. Can you get matched by just writing a lot of LTS? That's a very interesting question, to be honest. You can match without writing research too. That is for sure. There's been some of the people who never wrote a research article, but the thing has got so much competitive nowadays. Like I heard a lot of people saying how many average articles you have written. So LTs do pay a weightage to your CV, so do not take them lightly. If that get published, you are on the sky for that. I think that's worth it too. I hope I'm able to answer all of the questions. Sorry, Maria, I cut you because that was a very interesting question that I had to stop and answer that. And there's some questions about my USMLE journey. I think you can contact Eeman or me individually about it, and we can have another session for that to answer all of those questions because it does not align with the timeline. You can send me email too. I'm just going to write down my email ID over here so you can reach out to me if you want to. And last but not least, if you write some article and you want it to be just reviewed a little bit and you want my push, I would not be taking credit for that. If I have time frame and that my bandwidth allows me, I would love to review that for you. But always find mentors. Find mentors, work together, and you guys have a lot of big platform. You have like this big platform that you can utilize for your thing. It's a little bit extra work, I would say, with the studies that you guys do. But if you have will, and it takes time. So do not be rushed in the research things. Like if you have written a case report, it might take 6 months to get it published. So patience is one of the things that you need to learn during research journey too. Yep. Maria, you can wrap up the session. Thank you so much, everyone. It was lovely seeing you all and listening to your questions. Assalamu alaikum.
Eeman, would you like to add something?
Yeah, so I just wanted to say thank you, Dr. Mariam, for joining us today and taking out time to join us for every session that we ask you to come to. You're always so accessible, and we're grateful for that. And also, if you could just emphasize on the fact that LTs are, one of the first kinds of articles that people usually write, and especially as undergrads, it's pretty easy to get started on it. So if you could just emphasize on that fact so that at CHSR, we have people who are working on LTs, and also sometimes, as you've mentioned already, sometimes you don't get the output that you want. So, for example, like personally, I'm facing that right now. You are working on a lot of things, but they're not getting published. So, please just mention that fact as well.
LTs are just the first baby step towards some research thing. Eeman, I agree to that point. The thing is that you should be knowing what you're writing and how significant it is. That's why mentors are very much important. These people are more experienced. If I'm not that much experienced, then like there are other people like you should be reaching out who are more experienced in that literature way. LTs, do not take them like lightly. They are significant. Yes, they signify your voice in research forums because that is one of the way you're communicating to people. Oh, I think this thing should be like this. It should be like this, and it is important. Yes, and people do mention LTEs as references also in their articles. So don't take them lightly. So that it's just a communication. No, it's not just a communication. It is a research communication. It is a research worthy communication that you're going to write, and it has a voice to it. And other than that, articles not getting published or like that, I would say I have a very funny experience towards that too. So there were some things that never got published too that I was on too. So there would be some reasons behind that. Always see the criteria of the journal very strictly and follow that. If they've written 600 words, if you write 601 word, like 601, they'll refuse your article. To be honest, they're never, most of the journals are not that much flexible. And then they have their own scoring criteria that you have to meet. Then if there's a review committee, peer reviews are like bit of a nuisance, I would say, but they are what they are. So you have to comply with the rules and regulation of the journal at the end of the day to get that thing published too. Having said that, it does not mean that you have to like redefine your methodology, redefine all the stuff. If there's something weakness in your article, they'll mention it like in the comments. And if you improve your the things that they mention in their comments accordingly, then I don't think so you would have a trouble. Yes, sometimes something not get published. It's okay. Yes, no, it's okay. There's gonna be pauses. Yes, it's okay. There gonna be success. That's great. But if there's some failures, that's great too. So just bear with it. And you guys are doing a lot of stuff, like you're studying, you are doing all the stuff that college wants you to do. And then if you're putting extra effort into research, that's a bonus point that you are getting into your CV. I know CVs are getting competitive, but don't get that thing into your head and don't over stress on stuff like that. Do your pace, and it's okay. I always tell myself every day also, it's okay. So I would tell you too also, it's okay. Even if it is a sub stage you're not able to pass, it's okay. You can pass it. There's always a second way to find out a way out of the things. So even for the articles, I'll say the same. If that's not getting published in one journal, see another journal, see their own criteria, fulfill that, and get them published there. Do not waste your time on a journal too. That's also one of the tips that I've learned over the years.
So I guess we should wrap up now. I'd like to
Go ahead.
I'd like to thank you again, Dr. Mariam, for your time, and to everyone else as well for joining us today. Also, we have our next session on Saturday, the 7th of October, the next session in the CHSR's Workshop Series 2.0. Then we will be joined by Dr. Arsalan Nadeem, the president and founder of the Radiological Students Association of Pakistan. He will be talking about how to write case reports. So I hope to see you all again on Saturday, and thank you for joining. Allah Hafiz.